Perfect. All right. Hello, everybody. Thank you so much for coming. We're going to get started. So today it's going to be Tech Neck, and it's going to be Dr. Ali and myself, Dr. Evan. We're going to be talking over what Tech Neck is and all about it. But before we dive too far in, just a little bit about us. We are both chiropractors here at Active Sports Therapy. And we actually went to the same school, University of Western States in Portland, Oregon, just a couple years apart. And we've both been practicing for, oh, what, couple of years now total, I think. I think you've been at least a year and I've been about five. So lots of knowledge, lots of things to share. So we're gonna dive in and just a bit of an outline today. And I will mention if you have any questions, you can either put them in the chat and we'll cover them at the end. So just type them in there as they come up, or just hold them for the end. We'll open it up to a question session to cover anything that might come up. Okay, so just a brief outline. We're going to go over what TechNec is, who's getting it, what it looks like, what it feels like, and then we're really going to dive into what are the causes of it. And to do that, I got to go over a little bit of anatomy. So we'll talk about some bones, ligaments, and muscles. And then really what we want to know is what can we do about it. So I'll hand it off to Dr. Ali at that point, and she's going to go over what can be done about it, what's things at home, home care, exercises, stretches, what chiropractors and other professionals can do, and when we might want to seek professional help for the condition. So let's dive in. So tech neck, sometimes it's referred to as text neck as well. Medically, we refer to it as anterior head carriage, and that's exactly what it sounds like. It's when your head starts to come in front of our torso and lean ahead of us. So we can picture it pretty well in this image. It's what I like about this image is it shows that it's apparent in our neck, but it affects more than that. So it's going into our mid back. We can see that's even going to start to affect our lower back posture. So we're going to cover why this is going on. So first, who gets it, right? It's across all populations, and actually it's increasing across all populations. But probably the most impacted is the youth, right? So children, adolescents, and there's some reasons for that. And one of the biggest risk factors for tech neck is the usage of phones and tablets. So if we think about how often and how much screen time we're getting, especially on phones, it's pretty high in the adolescent category. So there's a paper that looked at this, but it's still a fairly new condition, so they don't have great metrics on it yet. But what they have found is that it is increasing across all populations, especially youth. And one of the other factors involved with that is the usage of backpacks too, right? So in this picture, we see somebody texting away, but not only is he leaning forward to do that, his heavy backpack is pulling him backwards in the opposite direction. So it's kind of a double whammy in that age group. But it's not the only group that gets it, right? Desk workers can get it with poor ergonomics. So something that we'll often see here is laptop usage. That can be a really tough one. This really spiked during COVID, where people were starting to move into home offices that weren't as ergonomically set up. Maybe they didn't have a proper office chair or a desk, or maybe they were curling up on a laptop on the couch, right? These are all pretty poor postures, especially if you're doing it for like 8 hours a day. So it's something that we'll be talking a bit about is like how to correct that, things to look for when you are setting up your home office. But it's not always screen time. There are other things that can lead to this, like reading or studying. So I pulled this cartoon because I felt like it's pretty accurate. Sometimes there's just like no good position to read in, it feels like. So definitely the neck ache position I see pretty often where people are, they get really involved in their book. They read it for 2 hours one night and they get like a kink in their neck. And it just seems like there's no correct way, but we can go over some of the more proper postures. Okay, so what does it actually look like and what does it feel like? So one of the things is the altered posture. It's probably the most apparent sign. The first thing that we're thinking about is that kind of forward lean. Sometimes we get that kind of like hunch between our shoulder blades. That's probably the most visually apparent thing. That brings a lot of people in by itself, but one of the main symptoms that people experience is the pain, right? So neck and upper back pain. It can go into the low back as well, but that's definitely a driver for people to be like, okay, it's time to get some treatment. So we'll discuss how we can help prevent that. Um, One thing that doesn't always come up when we talk about it, but it's stiffness and reduced range of motion. So what's happening is as we change our postures, those joints start to get irritated. They can basically get strained, and the joint decides to kind of lock up. It doesn't want to move as much. So you get that limited amount of range, and it feels quite stiff. Now, when you try to revert back to good postures, sometimes this actually the evidence shows that it can revert pretty quickly, up to like 50% of the kind of stress and strain on that can get reverted within a few minutes, but that other 50% can take longer. So that leads me to point four, which is that we get a reduced tolerance for holding proper postures. So the more we do this, it kind of feeds on itself like a negative feedback loop, right? The more we stoop forward when we try to return to a proper posture and hold ourselves upright, the muscles don't have the strength anymore to hold ourselves up for longer periods, which leads to us slouching a bit more. And it's this awful cycle that leads to just worse and worse postures and more pain. And it's something that we have to break, right? So that's usually where we step in and try to encourage strengthening certain muscle groups. It's very individual. Like on an individual basis of like which muscles you'll need to strengthen, but it's something Dr. Ali is for sure is going to touch on. And then headaches, not as common, but still pretty frequent. These headaches are going to be a little different than say like when the Chinook rolls through and half of Calgary it seems gets like a headache, right? Like this is going to start in the neck. It's going to probably radiate up the back. Sometimes it gets behind our eye. Usually feels more along the lines of like a tension like headache that's starting in your neck. So if you're getting this after, a long day's work or spending an hour or two reading or on your laptop, then that headache is probably associated with the neck and it's something that should be addressed. There are some more rare symptoms, but they do happen. So I'm going to go over them because they're important to identify. So the first one is neurological symptoms. So this is anything that has to do with the nerve. So on the picture on the top right here, you can see the vertebra of the spine and that little yellow band coming out. That's the nerve. When that gets irritated or compressed, that's going to lead to nerve symptoms. That could be feelings of numbness or tingling, burning, radiation. Sometimes people describe it as like an electrical like shock. And that could be anywhere along the nerve path, right? So it might be in the neck itself, but it could be all the way into your fingertips, right? Because those nerves, they start in your neck, but they go all the way down into your fingers. So anywhere along that pathway, it might be affected. The second one that we see, I've given it its own categories, dizziness, but it is still kind of a neurological symptom. What's happening in this case is the body uses a few different systems to basically balance us out. One is our visual input, like when we see things and we know where things are in relation to us, it balances everything out. Sometimes our neck, when these nerves get irritated, it can't send the proper signals of telling us where we are in space. And that disruption between the visual system and getting a mixed message from your neck, that disruption can lead to feeling quite dizzy. So it's something that we'll also see. And then the third is that we can have degeneration in the joints. So this could be the bone itself, it could be the ligaments that surround them, lots of different reasons to have that. But you can imagine just the amount of strain that we're putting on the system that it just kind of progresses over time and can lead to those degenerative changes in the joint. I did want to mention that there are slightly different reasons for having altered posture. And I bring this up because this was a situation where somebody came to me and they said, well, I'm having really bad posture. I can see that I'm getting this kind of lump on the back of my neck and, I want to correct it. In their case, they didn't actually have text neck. They had something called Cushing syndrome. And what happens in Cushing's is there's an excess amount of cortisol, which is our stress hormone. When that kind of dumps into the body, things start to change. And one of the things is where the body distributes our fat. So that adipose tissue can start to change locations. So typically for men, we're talking, the abdomen is a pretty common spot. For women, we're talking, through the hips. But in Cushing's, this is starting to change where now it's starting to get stored at the back of our neck. And so sometimes it's called a buffalo hump. And I have an example of it here, right? So we can see that she's actually in pretty good posture. Her ear is just in front of her shoulder blade. She's up pretty straight, but you can still see there's quite a large bump back here. This would be like soft to the touch, right? Because it's adipose tissue, it would kind of be soft. Um, it's just, if you suspect that you have this, it might not be postural. It's something to definitely go see your medical doctor or chiropractor. Just get it examined because it's a hormonal issue. It's not from the postural stuff that we're talking about today. So that was just kind of an aside to be aware of. But let's get back to technique. So what exactly is causing it? The it's basically a physics problem, to be honest, right? The force over a distance increases the amount of load. And what I mean by that is your head is around 4 kilograms on average. So when it's directly above your neck, it's just 4 kilograms of load directly into the neck. But as we start to lean forward, that load increases significantly, right? So in this picture, we can see at 15 degrees, it's already tripled to 12 kilograms. And the time we get down all the way down to like 60 degrees, it's 27 kilograms. It's a huge, huge amount. So you can imagine that that's going to be stretching and injuring and damaging your ligaments and joints, especially if you sustain it, right? And the way I like to put this is like if you imagine your shoulder checking in a car and you look over your shoulder and you come back, that's just a single time. You just went to the end range of motion and you came back. It's not so hard on the joint, right? If you were to look over your shoulder and hold it for 10 minutes, 30 minutes, an hour, you'd be like, oh, I'm going to have like a kink in my neck. It's pretty apparent to us that this would cause injury. But for some reason, we don't always clue in when it's looking down, right? But the same process happens. If you're looking down for sustained periods of time, the body can't handle that as well. And there's some changes that happen in the tissue, and I'll go over that. But just to kind of drive the point home, things that weigh 25 kilograms, they're heavy, right? So that could be a fully grown dog, could be something like checked luggage, it could be a car tire with the rim. Imagine having that much weight on your neck for anything more than a few seconds. It's just, your poor neck and your poor little joints, they can't handle it for that much time. Okay, so let's get into what's actually changing in your anatomy, right? So there's three big ones. There's the bone, it's changing position. We call that malalignment. The ligaments, they're getting stretched out too far. We're going to go over that. And then there's the muscles that are trying to control our posture, but aren't always able to. So let's go into each one of these. The bone, sometimes called the cervical in the neck, they're called the cervical spine. This is what they look like. I want to draw your attention to this one on the side, right? We have the vertebra in the front, a disc, a vertebra, and it just kind of repeats all the way down. On the back side, we have a second set of joints. This is called your facet joint. It's a slightly angled joint that allows for some movement, and it's surrounded by a ligament. We call that the facet capsule, right? I'm going to show you a couple images and some videos that show how much movement happens in this joint. And I want you to really remember that this is like an elasticy substance around it, right? That's going to have some give, but it only gives so much. So let's talk about the ligaments, right? They are stretchy, they are elastic, but you can only stretch them so far before they just don't have any more to give. You can picture it kind of like if you're taking elastic bands, and I don't know if anybody else has done this, but like sometimes you can stretch them to the point that when you bring them back, they're not torn, but they're not really elasticy anymore. So that same process can happen in us, right? So we call it creep because it slowly progresses over time. right? So imagine as your head kind of comes forward and your chin's jutting out, you're stretching all of these ligaments to like their edge as far as they can go. And when you finally do correct, some of that elasticity comes back, but depending on how much force and for how long, it might take them longer to repair, or in some cases, it could even be like more permanent damage, all depending on how much you've been doing of these postures with how much load, right? And then I just wanted to throw these images up. Like, don't worry about any of the names, but just there's ligaments everywhere in our body. It's the glue that holds our bones together. Without them, the bones would just fall off one another, right? So we can see that they're in the front, the back. They literally line every piece of it. So when we lean forward, not only are the very back ligament, it could be the front of your neck that's also getting strained. It's not that specific. It's global. Okay, so let's look at some examples. Here on the left, we have somebody leaning forward, and I'm just going to point some of the anatomy out that we went over. These are the vertebra in the front. Can you see the cursor? Yes, perfect. Okay. So the vertebra are these front ones here, and then slightly back, these are the facets, right? This is the one with the joint in between and the capsule around it. So you can see up here, there's, a pretty good overlap. And then look, as it starts to slide forward, there's only like 50% overlap here, and this one almost no overlap, right? Almost no overlap. That's the point. Like it's getting so stretched out at these end ranges. So you can imagine that capsule's all the way to the end. And if you're holding that for long periods of time, it's just not sustainable. And what that can lead to is these changes. So here we have a healthy spine. The green line is basically what we would call kind of an ideal curvature, right? We're not all going to meet it exactly, but it's kind of what our goal is. So they've drawn the line of this person with the red lines, and it's pretty close. It lines up pretty similarly, right? Everything's on top of each other. There should be a natural curve. When we go over to this person, okay, here's the green curve. The red is not even close. It's almost vertical. If not, it almost reverses in one part and then comes back. Okay. So what's happening in this case is things have happened for so long that the literal bony alignment of the neck has started to change. And in this case, it's okay, we might not get a full curve back, but how can we help sustain, strengthen certain muscle groups, prevent certain poor postures to try to basically stabilize what has happened over maybe months to probably years in this case. Okay, let's look at some videos. So this person is extending backwards, and I'm just going to show you again. Here's the vertebra in the front. Here's these facets, the kind of angled joints in the back. And you can see that they just slip and slide over each other. That's natural. That should happen. But this person's leaning back. I do have a video of somebody going forward. So same concept, right? Here's the facet joints, and you can see them starting to slide past each other. And then same thing when you lean backwards, they move up against each other. So that is showing the amount of stress that happens if you're constantly loading them. What else is happening in there that you can't see with those x-rays is that the nerves are going to be compressed. So these little gaps here that we can see, that's where that nerve root comes out. And we kind of touched on this before. But what's interesting is as the spine moves around and shifts, the amount of space for those nerves also changes. So on the picture on the right, as that one's lifting up, the space actually increases for the nerve. But as this one shifts down, we can see that the amount of space decreases. So in tech neck, as it slides forward, this top one is actually going to start to eat away from the back side. It's going to limit the amount of space for the nerve in that way. And this is why when it's kind of on the more severe side, then you might get those nerve symptoms. Remember, that's the burning, the electrical like pain. It could be numbness, weakness. Any of those are kind of neurological symptoms. And then lastly, we have muscles. So when we look at it from a muscle perspective, sometimes we refer to this as an upper cross syndrome. It's the same idea as text neck, except we're only looking at it from the muscle lens. And what happens here is that we tend to get a cross pattern of tightness and an opposite cross pattern of weakness. So if we look at kind of the back of our neck, the upper trap into the base of our skull, these muscles, they tend to get overstretched as we lean forward, and that can lead to the muscle becoming quite tense and tight. The same happens for our pecs, right? As we lean forward, the shoulders tend to round. That can lead to tension in the pectoral muscles, and they're going to get tense. So that's one pattern. The opposite direction, we tend to get inhibited muscles that are not being fired correctly, and they become weak. So if we think about the muscles underneath our neck, as our chin comes forward, they sustain that load. They don't have to fire as frequently, and we tend to become weak in them because we're not activating them anymore. So again, depending on the person and what their symptoms might be, this might be an area that we have to strengthen. Same thing for the lower traps, right? This kind of mid-back area. Those muscles should be helping to fight against our head leaning forward. They should be helping to correct our posture. But typically over time, they're just too weak to fight back. And that weakness leads to this upper cross syndrome. So this is just another example, right? So this just shows the posture, right? As these ones tighten and these weaken, we tend to get into that stooped posture and we have a harder time returning to proper posture. And then if we let's just review like what caused this, right? There's three main things. There's the change to the bones where they're shifting forward on each other. There's the change to the ligaments where they're getting stretched out and losing some of their elasticity. And then there's the muscles that are constantly either being held too tight and they're going into tension, or they're not being utilized enough and they're becoming weak. So that paired with overuse of phones or poor posture at work, all of that is going to lead to tech snack. So the big question is, well, what can we actually do about that? And I'm going to hand it off to Dr. Ali to discuss that section.
Right. Do you want me to bring up my screen here, Evan?
Yeah, I'll stop sharing and we can transfer it over.
All right, everyone see my screen here? Okay, I'll just fast forward to where we were. All right, so we're going to dive into some treatment options here for tech neck. So at AST, we have multiple practitioners under our roof, multiple disciplines, different specialties. So we're going to talk more about how chiropractic care can help with tech neck, as Dr. Evan and I are both chiropractors. But just know there's also options with physio, massage, acupuncture, and we strongly believe the more players on your team, the better for your care. So we're going to talk more about chiropractic here. So one of the most common misconceptions Dr. Evan and I both here in our office is chiropractors just adjust the joints. This slide's going to talk about all of the tools we have in our toolbox to treat the joint, the muscle, the ligaments, the nerves, and the different options we have for each structure in the body. So for the joint, really the goal, what we're trying to target is when we're seeing those changes within the joint, commonly it gets locked up. The joint's not moving the way we want it to, depending which direction it is restricted. So the goal with our adjustment is restoring normal movement within that joint. A typical manual adjustment involves movement. There's commonly heard or felt some popping and cracking. What that is just nitrogen gas being released from the joints. Your bones aren't moving back into place. We're truly just restoring joint motion. But just know that if you don't like being adjusted, also, adjustments aren't indicated for everyone. We also have other options to get those joints moving better. So we can mobilize the joint, involves moving it again into the direction it needs to go. And it just doesn't entail any fast movement, often no cracking, popping. And then lastly, we have this activator tool here. So it's very gentle, can be a great alternative if you don't want to be adjusted or an adjustment isn't indicated. It's very precise. Again, we're just targeting that joint, trying to restore some movement back in there. And then for the muscle here, so all of our chiropractors at EST are trained in active release technique. So it's a really beneficial technique, really targeted to treat those tight muscles, scar tissue, muscle adhesions. And it's one of the only techniques that we're actively lengthening the muscle as we're working on it. So because our muscles transition from shorten to lengthen frequently throughout our day, it is important to treat it through its lengthened position. And that's truly what's going to help release some of that muscle tension. We can also use instrument assisted soft tissue mobilization, also commonly called scraping or Graston technique if you are certified in that. Involves a stainless steel tool, often friction going back and forth on the muscle. Again, we're just trying to target those tight muscles, release adhesions, and help release some of that tension within the muscle. We can also utilize cupping, whether the cups are dynamically moving on the muscle or statically put on the muscle for a couple of minutes. We're just trying to bring in some blood flow to help release some of that tension. And then we also have some great additives to treatment. So IFC is a great tool to use after we've seen you in our office. We can set you up on the IFC. It's pads that are placed on specific muscles. You'll feel a buzzing, tingling sensation. And really the goal with this is just help to relieve some muscle tension, and it can feel quite nice after receiving treatment. And then in this photo here, we have a laser machine. The goal of the laser is to can penetrate pretty deeply right down to those structures we're trying to target, helps bring in blood flow, which promotes healing, and in turn can help limit some inflammation. So in terms of the muscle, works really well for muscle strain, whether that's more of a repetitive strain, most commonly in the case of tech neck, or an acute strain, you just injured your neck, car accident, whiplash, anything like that. And then lastly, most of our chiros will often give you some stretches and exercises to do at home. This is pretty stretches, exercises are really what's going to help get you better faster and help maintain your progress. You're only seeing us in our office for a short period throughout your week. And what can you do at home to maintain those results? And most likely the demands of your job aren't changing. So, what can we do to help you manage some of that throughout the week? Again, touching on the ligaments here. So, naturally, ligaments don't receive as much blood flow as a muscle will. So, a ligament sprain is often a little bit slower to heal than a muscle strain will be. So, that's when these techniques, active release, again, a useful, beneficial technique to target those specific ligaments. But again, the laser really comes in handy here because it's naturally trying to drive some of that blood flow to that sprained ligament. And then we'll touch on the nerve a little bit. Again, like Dr. Evans said, nerve is not as commonly involved, say, as the joints, muscles, and ligaments will be. But if you are presenting with some of those neurological like symptoms, the numbness, that tingling, it's most commonly due to some nerve compression at some point throughout its path, whether it's in the neck where it comes out, or if one of the muscles it travels underneath is tight, it can compress the nerve. So in that case, active release again works really well. And then some targeted exercises we can do are nerve gliders or flossers. Really, the idea is we're getting the nerve moving from its starting point in the neck and then having movement throughout the entire pathway of that nerve all the way into the fingertips. Depending which nerve is involved, which we often test for in our office, will determine what type of nerve glide exercise we give you. And then we'll move into a few home care specific things you can take home with you. I want to preface that these exercises are not a one size fits all. I always get my patients to demonstrate these stretches or exercises. I'm going to prescribe them for me in my office before I give them as homework because I want to make sure that they are doable, they feel good, they're not going to aggravate your symptoms. and it doesn't irritate any other ailments potentially in the body. So just know these aren't going to work for everyone, but these are some commonly prescribed stretches that I will give to my patients if they are presenting with tech neck. So the goal of these stretches are really just to help with those tight muscles, upper trap, the levator scap, those pectoral muscles. Those are the three commonly involved in that upper cross syndrome Dr. Evan touched on. So these are the muscles we commonly want to stretch. So with any sort of stretch, how we achieve that in range of tension is we find the action of the muscle and then we do the opposite to lengthen it. So, for example, this upper trapezius muscle here, if I'm trying to stretch my right side, I'm going to tilt my head away to the left side. I'm going to turn it slightly to the right, and then I'm going to look down towards my right knee. A key point with this stretch here is because the upper trap is involved in raising our shoulders up towards our ears here. Naturally, as humans, we'll find that our shoulders want to creep up to our ears, commonly when we're working at our desk, if we're typing on the computer. So, really important with this stretch to make sure that shoulders dropped nice and low to increase the space in between our ears and the top of our shoulders. You can do that by tucking behind your back, like in that photo, or sometimes I'll even have my patients sit on their hand if they're doing the stretch seated. Just make sure that you're not counteracting that stretch by letting that shoulder creep up. Levator scapula works very similarly. The only difference here is we're going to tilt away, but then we're going to also look away. So you're going to feel that stretch in a slightly different position than you will the upper trap. With any of these stretches here, the key is to hold them for about 30 to 45 seconds. Naturally, you will feel the muscles start to let go a little bit throughout that time. It will start to feel easier. That's a great time where you can sink in a little bit deeper into that stretch. We don't, with these specific stretches, you can add some additional overpressure on the head here to sink further. Really important here, make sure you're not yanking on the head. We don't want to damage the muscle, and I don't want you bouncing back and forth once you're in that stretch position. Again, that can damage the muscle. So just get to that point of tension, hang out there. If you feel like once you're there, you can sink in a little bit deeper, then that's a good point to do so. Lastly, to stretch the pectoral muscles here. So we have the pec major and the pec minor. You can stretch both at the same time, leaning into a doorway. You can also do one at a time. Again, you lean forward and you can even rotate your torso slightly away from the side that's being stretched. It'll just get a different fiber on that pec muscle there. Touching on mobility now. So the goal with mobility is trying to restore normal joint movement. So these exercises are targeting the thoracic spine or the mid back. And cat-cow, it's a yoga position, but it's also a really great exercise because it naturally flows throughout the flexion and extension of the thoracic spine. It's a great one to do at home. You can breathe through it and it should feel comfortable for most people. Thread the needle works similarly, but we're trying to get more thoracic rotation as opposed to flexion extension. With this one, for my patients that have shoulder issues or it's uncomfortable to reach that arm all the way up, I'll have them just tuck the hand behind the head here, and you can still really achieve some good rotation. If this is uncomfortable on your knee, you can place a pillow under one or both knees. And then thoracic extension over a foam roller. So first of all, make sure you have a smooth foam roller rather than one that has those indents in it, as that won't be very comfortable poking into your spine. You want to place the foam roller horizontal to your spine and you lay it on your back. You just gently relax over it and you can hang out there again 30 to 45 seconds. You may feel some movement in the spine, popping, cracking. It's natural, normal. Again, you're just restoring some of that joint motion. Once you felt like you have got that spot moving a little bit better, you can either move the foam roller above or below that segment and release the entire portion of the thoracic spine there. And then moving into strength. So these strength exercises here are targeting some of those commonly weak and inhibited muscles within tech neck. So that first one here, deep neck flexors, these are the muscles at the front of our neck. As Dr. Evan mentioned, they are commonly not engaged. They are underactive when we have that jutted out chin position here. So to strengthen them, we want to do the opposite. So a pretty basic starting exercise are chin tucks. You can do them either laying on your back or standing with your head against the wall. You are going to just tuck your chin in as if you're making a double chin. So if you're laying on your back, you're going to drive the chin straight down. Um, and then again, with any sort of strength exercise, we start baseline based on how things feel, whether it aggravates your symptoms. And then it's really important to progress those exercises as they become easier. Also, it's important for us to make changes if they're not working for you. So again, these aren't going to work for everyone. And the more you do them, they will feel easier. And that's at a good point that we want to start to move and progress them. So the natural progression for the chin tucks will be to tuck the chin and then add a lift while you're laying down. This next exercise here, so they're called Blackburns or eyes wise tees. They they work really well to strengthen a multitude of muscles within the back here. So most commonly that lower trapezius is the not firing. So the trap muscles shaped like a diamond. Those upper traps are the ones that are commonly tight, overactive, and then it's the bottom ones that are generally underactive and inhibited. So we want to work to strengthen those. So this exercise, I commonly have my patients start standing, facing the wall, flowing through those movements. And then the next progression, once that feels easy enough, is to do it laying face down. And you'll flow through the I, the T, and then the Y there. And naturally, this exercise also strengthens those rhomboid muscles, which are these muscles in between our shoulder blades here. They're commonly overstretched when we're at our desk here. Anytime we're in this forward flex position, those muscles in between our shoulder blade will lengthen anytime we hold a muscle in a lengthened position for a long time. It can become weak. So any sort of row, whether that's banded, cable row in the gym, when you're squeezing those shoulder blades back together, that works to strengthen those rhomboid muscles. But naturally, the T position of the IYT here will work to strengthen those muscles as well. And then just a few points on desk setup here. So there are a few things you can do either at your home office, your office, downtown to allow for proper position and also just less strain on the body. So the main one here I would say is monitor height. So having your monitor at eye level allows for the neck to be in a rather neutral position instead of constantly looking up or down all day. If you're working off two monitors, the more that you can have them in the center of your computer rather than off to the side. Because if I'm always looking at my monitor on the right all day, it's a lot of strain on one side of my neck. So equally sharing between both monitors and having them as much of in the center of your desk as you can. And then bringing me to my next point, your desk. If you can, I highly recommend a sit to stand desk to allow for frequent positional changes. This is not only going to help tech neck, but it's going to be beneficial for the entire body. Anytime you're in a seated position for long periods of time, your hip flexors are naturally going to shorten, which can cause low back pain. So if you can incorporate a sit to stand desk, it really just allows for you to change your position frequently and it prevents that repetitive strain, which is commonly what we see causing tech neck. Which brings me to my next point of micro breaks. If you can, throughout your day, as often as you can, I would encourage a micro break. And it doesn't need to be, a 20-minute coffee break. It can simply be just taking a few minutes to roll those shoulders out. It's a great time to do those upper trap and levator scap stretches I demonstrated that don't require you to get down on the ground, but also just getting that neck moving it around in its natural positions restores some of the blood flow to those muscles and help prevents overstrain within those muscles, which can happen when we're holding a position for too long. And then lastly, here, your desk chair. So most desk chairs nowadays will have some sort of lumbar support, which is great. That can help the low back specifically, but overall, just the position of our spine throughout the day. And then having a desk that has an adjustable height or a chair that has an adjustable height so that you're not either working down at your computer or reaching up towards it, one that can allow you to be more at a neutral position. And then when do we seek care? So, most commonly, we'll have people come to our office because pain or discomfort's bringing them in, whether that's neck pain, mid back pain, any sort of neurological symptoms, if the nerves involved, numbness, tingling. Again, it can be numbness, tingling in the shoulder, or it can go right down into the fingertips, anywhere along the path of those nerves. Headaches, as Dr. Evan mentioned, is a big one. Whether that's a tension type headache stemming from the tight muscles, they commonly present as a band like distribution around your head, and they'll usually start later in the day at some point in the afternoon after you have been straining those muscles and tissues for hours throughout the day. It can also present as a cervicogenic headache, which just stems from any structures within the neck, similar distribution. You'll feel it around the head here again. It can radiate upwards and even back behind your eyes there. And then muscle tension, feeling like your shoulders just won't relax. They feel tight, doesn't matter how much you stretch, can be a good indication that's a great time to see us in office and get some hands-on soft tissue work, but also proper stretches and exercises that can help. And then lastly, preventative care. Most likely the demands of your jobs aren't changing, and preventative care can be great at keeping your symptoms below that threshold of symptoms. With tech neck, it's more of a repetitive strain injury. It's not like I turn my head really fast and I hurt my neck. It's usually been building and building for a while, and it can often just be one little thing that crosses that threshold of symptoms. It's when your neck, upper back will start to get sore. Preventative care is a great tool to keep things at bay, give you the stretches, exercise you need to do at home, but as well prevent those symptoms from becoming problematic throughout your day, as well as if you've had an episode of neck and upper back pain as a result of tech neck. Once we get those symptoms at bay, maintenance care, checking in every 4 to 6 weeks, a timeline that works well for you, is quite beneficial again to keep those symptoms at bay and prevent crossing the threshold where things start to get sore again. And that is all we have. We want to thank you all for tuning in. And now we're going to open up the floor if anyone has any questions for us.
I don't know. Can people unmute? Is that you can type it if you do have questions. Otherwise, I don't know if you guys can unmute. Okay. Maybe there are no questions. Okay.
I guess I've got a question. I can
Oh,
jump on and do that. I just don't know if
yeah.
I can see everyone. Thank you, first of all, for the presentation. Really interesting. I can see how there can be some adjustments to my home office here based on what you're saying. Is there anything for between the shoulder blades, a little lower down, to try and get some of those pains addressed?
You can take this one, Ali.
Yeah, so we're like right in between the shoulder blades or below the shoulder blades.
I can try and point to it. I don't know if you can see.
Yeah, yeah.
It's just about there.
Okay. Yep,
So it
yep.
feels like it's related to the that sort of posture, the little dinosaur hands,
Yeah,
but
yeah.
it's a little bit lower down. So I sometimes
Yeah.
wonder if it's something else that's happening or if it's related to the neck strength.
Yeah. That's typically the rhomboid muscles. So those can get irritated again if because their action is to bring our shoulder blades together. If we're
Right.
at our desk, they're in that overstretched position
Yeah.
commonly. So those seated rows are great to strengthen them, but
Okay.
that's also a muscle that will commonly get little trigger points. So it'll
Mm.
feel like a knot that just won't
Hmm.
release. That can be a great time to seek care. And there are some pretty beneficial techniques to help release some of those trigger points.
And would that be bone related or muscle or maybe a combination of the two?
It is a muscle, but they often work together.
Yeah.
It's whether the muscle was tight first and that made the joint stop moving, or
Mm.
if the joint was stuck and the muscle went into spasm to compensate. They
Okay.
usually go hand in hand. So that's why we always want to treat both. It's important to look at the muscle and the bone.
Okay. Makes sense. Thank you.
Yeah, no problem.
Good.
Yeah, I'll just add one thing to that, which is when you do the rows, make sure you actually follow through and pinch, right? Because often what we'll see is like, oh, I'm doing rows to strengthen, and it just ends up being a bicep curl, right? So make sure when you finish that row, your shoulders are pinched all the way. That's what's actually going to strengthen it in the long run. But yeah, exactly what she said. It's most likely rhomboid, but it is always a bit of a joint thing, right? Where it's if the muscles connect to the bones, so it's going to be a bit of both.
I'm glad you clarified. I used to be a rower, so I know that feeling to bring your shoulder blades together.
Gotta pinch them.
Yeah,
Yeah, yeah, and it's
yeah.
just above there, so it's in a really odd spot that is catching. And
Yeah.
so I was always curious, but appreciate it. Thank you.
Mhm. Yeah. All right. Is there any other questions before we wrap up? Okay. I think we're good.
Thank you guys. I'm just on the back end making sure everything's functioning. Thanks everyone for coming tonight on this beautiful evening. And there'll be a follow-up email coming in the next few days with a recording of this if you want to share with any of your clients or friends. Thank you, Dr. Evan and Dr. Ali. We appreciate it, and we hope to see everyone in the clinic. Take care.
Bye.
Bye.
Bye. Thank you, everyone.